The Apgar score is a quick, standardized tool for assessing a newborn's health immediately after birth. Originally designed by Dr. Virginia Apgar, an anesthesiologist in 1952, it provides a simple and systematic way to determine whether a newborn needs immediate medical care. The Apgar score, measured at 1 minute and 5 minutes after birth, is based on 5 criteria, each worth up to 2 points, giving a maximum possible score of 10. The name Apgar serves as a mnemonic to help remember the 5 key components of the score. The first component, appearance, evaluates the newborn's skin color. A score of 0 is given if the entire body is blue or pale. If the body is pink but the extremities, such as the hands and feet, are blue, a condition called acrocyanosis, it scores 1 point. A score of 2 is assigned if both body and extremities are pink. It is important to note that acrocyanosis is common in healthy newborns and often resolves within the first 48 hours as the newborn's circulation adjusts. However, if it persists or is accompanied by other symptoms, it may require further evaluation. Next is pulse or heart rate. It is assessed using a stethoscope or an electrocardiogram. If the pulse is absent, it scores 0 points. If the pulse is less than 100 beats per minute, it scores 1 point. The normal newborn heart rate is more than 100 beats per minute, which earns a score of 2 points. The third component is grimace, or reflex irritability, which assesses the newborn's response to stimulation. A score of 0 is given if there is no response. If the newborn shows a weak cry or grimace, such as a frown or wrinkled forehead and nose, it scores 1 point. A score of 2 is awarded for a vigorous cry, coughing, or sneezing. Next is activity, or muscle tone. If the muscle tone is limp and floppy, it scores 0 points. If the neonate demonstrates some tone and flexion, it scores 1 point. A score of 2 points is awarded for active movement and good limb flexion against resistance. The fifth and final component is respiration or breathing effort. If the neonate is not breathing, it scores 0 points. Weak, irregular, or gasping breaths earn 1 point. If there is a strong, regular cry or breathing, it scores 2 points. An Apgar score of 0 to 3 points signifies a critical state for the newborn. This score reflects severe distress, necessitating immediate resuscitation and continuous vigilant monitoring to ensure the baby's survival and recovery. A score between 4 and 6 points reflects moderate distress in the newborn. This may require some medical intervention, such as suctioning or supplemental oxygen. A score of 7 to 10 points indicates good health. The newborn typically only needs routine post-delivery care. If an infant scores less than 7 at the 5-minute mark or requires resuscitation, the score is reassessed every 5 minutes, usually up to 20 minutes, to monitor the baby's condition and response. While the Apgar score is a valuable tool, it has its limitations. It is not a definitive predictor of long-term health outcomes or neurological development. Also, factors like maternal sedation, preterm birth, or congenital anomalies can affect the score. Therefore, it should be used as part of a broader assessment rather than the sole indicator of a newborn's health.